Hi, I'm Dr. Melita Tate,
Hi, I'm Brooke Shivey, a family nurse practitioner here at Grassroots Healthcare.
and we wanted to talk today about one of the things that we're very passionate about, which is hormone replacement therapy, and just checking your hormones, hormone balance, making sure that your hormones are in balance and that everything is, running smoothly with you. Hormones can make us have so many different symptoms. So we typically will see patients just in any age or stage of life with their hormone being, maybe they've noticed changes in their menstrual cycle, or following a pregnancy, they'll sometimes see hormones reset and they're not the same as they were before. Maybe they're having trouble getting weight off because, after the pregnancy, their hormones are just not in balance. Maybe you have unwanted hair growth in places you didn't expect to have it. You could have had a surgery or have your ovaries start to fail, as we do during menopause. And what I tell my patients is that a lot of our illnesses go up and increase after menopause. So we know that heart disease goes from 1 in 7 females down to 1 in 3. And a lot of this is because Mother Nature is cold and cruel, and she's like, oh, you're no longer reproductive, you may exit the planet. And we don't think that's fair. So we try to keep our patients from needing medications here at Grassroots Healthcare. And one of the ways we do that is to try to keep them young. And so if we can help your hormones to be back in balance naturally, or if we need to do something with some sort of treatment to get your hormones to come back in balance, we're all about that. We love helping our patients find their best version of themselves. And when they feel their best, then they're going to be the best for their family and for their job. And that's what we want to do. So we start looking at your hormones at different stages of life. And there's some of the symptoms that come up for our patients with hormones, like the fibrocystic changes in the breast tenderness. We see it with period changes or
New onset of anxiety, sleep issues, hot flashes.
Yeah, hot flashes is a big one. Depression, we'll see it with just changes in, like you said, the sleep, and just the general sense of well-being can be affected by the hormones. And we're also seeing that happen to our patients younger and younger, sometimes heart palpitations. A lot of people don't realize that progesterone, one of our main hormones that we all have in our system, really acts on the brain and has a lot to do with our GABA receptors in our brain and our feeling of calmness and, just keeping us in balance. And as we are seeing our society change, and we're getting a lot of endocrine disruptors in our food products and our makeup and everything that we eat or drink, those things can affect our balance of our progesterone and our estrogen. And so sometimes we'll see ourselves being more irritable because maybe we're estrogen dominant. We see an increase of autoimmune conditions because the progesterone, which is more of an anti-inflammatory, is out of balance with our estrogen. So it's a really great thing to get your hormones tested. So we wanted to talk a little bit about today how you get those tested, what you can find out, and then kind of what we do, what's our general way to treat them.
Right. So here at Grassroots Healthcare, we offer 2 different main ways of checking our hormones. We can check it via serum, which is your blood work, a lab draw. We do prefer, though, that we check it via saliva. So we have a saliva hormone kit that we send home with you. You get to do it in the comfort of your home. You collect that sample and then send it off. It comes with a prepaid shipping label. Very easy process to collect your saliva so that we can have a correct match and level measurement of where your hormones are.
Yeah, so typically we worry about progesterone, testosterone, and estradiol. We women do have testosterone in our systems, and it can affect our sex drive, our desire to initiate sex. So we make sure and check all those things. Sometimes we check kind of the hormones that help us make our other hormones, and we also like to check sometimes cortisol, and we can do all of that here. So what we like to do is check those. We were really interested in what your levels are and then how they are in balance with with each other and where they are in your cycle. So we really like them to be tested, at a certain time if you're still having menstrual cycles. Right. And our friends at Economy Pharmacy, they keep test kits over there. So if you want to go by and pick one up, you can go ahead and send it off. You can always call Jane up here and make an appointment, and we'll go over with you, at your visit what your symptoms are, and that kind of gives us a good guess at what your levels might be. But then we get those levels back and we can relate those to what kind of symptoms that you're having.
And hormone replacement therapy is very, very individualized. So it's important that we get all of your symptoms, what you're experiencing as an individual, and then collecting these samples at the correct time, which is huge. I've had many patients that come to me and say, I've always been told my hormones are okay, but the process of collection maybe wasn't correct, or our hormones do change with time. So it's important that we follow all of these tedious steps to figuring out what's going on with you as an individual and not just the general.
Right. Because there isn't a one size fits all. Hormones are very, like she said, individualized. And what may be right for one person is going to make someone else feel bad. So if we can correct some of your inability to sleep, we can make you better, quicker, sharper at your job. Hormones play such a great role in our cardiac health. There was a study that came out, and we talk about this with each one of our patients when they come in. There was a study came out that, the HERS trial, where they, took every woman off hormones, and now they've gone back and corrected that and said, wait, some of that data wasn't, applied appropriately. And so the pendulum's starting to swing back, and we're seeing more and more patients come in for hormone care and hormone balance now. It helps prevent your ability to lose your words, your memory, those kind of things. It helps prevent your bone loss. So there's a lot of things that hormones can help with. So we're not just looking at replacing your hormones so you feel great or your sex drive. We're looking at preserving brain function, because you have receptors in every cell of your body for progesterone, estrogen, and testosterone. And so it really makes a big difference for just how quick you can come up with something. You start to notice that you're losing that. It may be a great time to test your hormones. There could be a myriad of things that are causing it, but it's a good idea to consider hormones. And a lot of mainstream medicine doesn't consider it right now. It takes quite a while for the changes that we see happening in the studies to get put back into mainstream medicine. So we're very passionate about helping people correct their hormones here. And patients have a lot of questions about, well, how often do I need to do it? Can you get my hormones back into shape so that I don't have to take anything? And the short answer is, a lot of times, if you're deficient in hormones, we can. If you're younger, certain times of life, we still don't have a quick answer to get people well without having to take some sort of a supplement. So people are worried about how much is that going to cost. And so I'd recommend that you schedule a visit to go over some of those things with us. Usually, like I said, it costs around $100 to $200. We try to check your hormones pretty frequently. Initially, like every 3 months. But then after we get you on a stable dose and you're feeling great, we sometimes go to every 6 months. And that can cut on the cost.
Yeah, that's important too, that we keep a close eye on our patients, because if we do start hormone therapy, we want to make sure that level's right for you. Everyone responds differently to therapy. Everyone's dose is different. And if we are keeping a close eye monitoring your levels, then we're doing a good job on our behalf as well to get you to the optimal range. So these lab checks are important. And like Dr. Tay said, we do check once every 3 months at the beginning, typically, and then can move to that once every 6 month mark.
And so some of the treatment options that you have to do if your hormones are low, we have oral. We like to give oral progesterone. Sometimes we can give your hormones in a cream form. There's injectable, there's dissolvable kinds of medications. So there's all different ways. So each person really helps decide for themselves what works the best for them. There's all kinds of questions about family history. Hormones don't cause cancers, especially if we're treating someone in a range that's supposed to be. But that's what people worry about. So we try to reassure people that we're not using any kind of synthetic hormones that increase your risk for cancer. We try to treat our patients with the lowest dose possible of medication that they would need to get them feeling their best and to preserve longevity, your mental health, state, your quickness, your memory, your heart. All these things we take all of these things into account when we're treating with hormones. If you're interested in getting your hormones checked, or you just want to know more about it, you can call up here. Any of our staff would be glad to talk to you about it, get you scheduled for a visit with us, and at least get your hormones tested and sit down and talk with one of the providers here at Grassroots. So you can reach us at 918-878-7733, or if you have further questions, you can put that below in one of the comments and someone will get back to you.